am a nurse from the Orthopedic Surgical Unit at Iredell Memorial Hospital. We look forward to providing you with excellent care as you recover from your total joint surgery. After you have recovered from anesthesia and PACU, you will be brought in your own surgical bed to your room. Once you arrive, you will be greeted by a nurse and CNA who will take your vitals and perform an assessment. Vitals will be taken hourly for 4 hours and then once every 4 hours for the remainder of your hospitalization to monitor your response from anesthesia and surgery. A device known as sequential compression device, or SCD, will be applied to your calves. This will help with circulation in the legs, and since your mobility will be temporarily decreased, it will help with prevention of blood clots. Typically, IV fluids are given until you are eating, drinking, and using the bathroom. While these fluids are usually stopped within the first 24 hours, the surgeon will determine what's best for you. Depending on how easily you wake up from anesthesia, you may be given oxygen and have pulse oximetry, a device placed on your finger to measure how much oxygen your body is receiving. These are also typically able to come off within the first 24 hours. During your stay, our respiratory therapist will bring you a device known as an stethospeedometry. You will be instructed on how to use the device for breathing exercises and will need to use it for at least 10 times every hour. It helps to expand your lungs and prevent pneumonia. When you leave the hospital, you will be able to bring this device home with you. Your surgeon will prescribe pain medication for you. Your nursing team will discuss with you the medication, the dose, and any potential side effects. Our goal is to keep your pain tolerable during your stay. Please keep in mind that pain is expected after this type of surgery. We will establish a personal pain goal with you and encourage you to communicate with your nurses regularly about any pain you're experiencing. We typically recommend taking pain medication with breakfast before your first physical therapy session and at lunch. Depending on your pain level, to prepare for your second session with physical therapy, we will also use ice to help decrease any inflammation and pain and repositioning. Depending on your surgeon's orders, you may have your dressing changed on the first or second day after surgery. These dressings can range from a gauze dressing with medication to something known as an aquacell dressing that stays in place for 7 days. More information on how to take care of your dressings and incision site will be given during your discharge instructions from the hospital. During your stay, our goal is to keep you safe. You may feel slightly weak and may have a hard time moving around, so it is very important for you to call for assistance anytime you need to get out of your bed or chair. We take extra precautions to prevent falls and will provide you with non-slip socks to wear while you are hospitalized. We may also use a special type of belt that will help you move from one piece of furniture to another, known as a gait belt. On the day of your discharge, your surgeon will come to see you to discuss your departure from the hospital. You will work with physical therapy on that day, and depending on how your session goes, you will either be cleared to leave or have another session scheduled for the afternoon. Your surgeon will be updated on your progress, and if they feel it as appropriate, will issue an order for you to be discharged. We will arrange follow-up appointments with your provider for you and gather any supplies and prescriptions you need. We will also review important education with you and a caregiver of your choosing, and then escort you to the exit via wheelchair, where we will safely help you get into your vehicle. Once a discharge order is entered into our electronic system, the entire discharge process typically takes 1 to 2 hours.